Well, I keep this as informal as I possibly can, so I'll do my best to, Jack Kennedy used to say, after the first 15 minutes with politicians, it's all downhill. I'm sure I can stay within 15, but I'll try to keep the clock on. And of course, one of the wonderful things about coming to Bridgewater is that you've got this terrific train. It's practically on the campus, and I had something to do with it. So if you want to move the train down here, decide what the station ought to be, the State College. It makes it very convenient for me to come down. On the other hand, I must be on the 335 going back. So we only have about an hour. But my thanks, and it's great to be back with you. Just to follow up on the Provost's comment, I really have an apology to make to all of you. Because if I had beaten Bush 1, you'd have never heard of Bush 2. And we wouldn't be in this mess. It's all my fault. When we get to the Q&A, I'll be happy to respond to any of your questions. And I think all of you know, I don't have any difficulty being candid. And I will be that. But this is the second time, I guess, I've addressed health policy here. I was here a few years ago, talking about it some length. I'm not sure at that time we had the slightest notion that an African American would become the President of the United States, and that one of his top priorities would be health care, and that we would find ourselves in a position where maybe, just maybe, this country is prepared to join all of the other so-called advanced industrialized nations of the world, and some of them aren't so advanced and industrialized, in guaranteeing all of its people comprehensive health care. We'll see. But I want to talk about that a little bit, and then we'll open it up and have some questions, discussion. Who was the first serious presidential candidate to propose universal health insurance in the United States of America, and when? You get this question, you don't have to take it fine.
Teddy Roosevelt?
Yes, indeed. What year?
1900, 1904, close, 1906.
Teddy Roosevelt, 1912, when as the so-called Bull Moose candidate. Remember, he served after the Kennedy's assassination, was reelected, left, Taft came in, wasn't happy with Taft, decided to run as a third-party candidate. He very well have been the guy that was responsible for Woodrow Wilson's election. In 1912, Teddy Roosevelt proposed essentially that all employers be required to insure their employees and their family. Now, if you know anything about American history, folks, that wasn't exactly a radical idea. Why do I say that? Because in 1908, beginning in this state, states began passing workers' compensation statutes, or as we call it in those days, workmen's compensation statutes, designed to compensate workers for injuries sustained on the job, without regard to fault. And you got your medical expenses, your lost wages, and a little something more. And it all started right here in Massachusetts. But Roosevelt got his inspiration from a guy named Bismarck, interestingly enough, who was the German chancellor in the late 19th century, a conservative, a very conservative guy, who proposed a sweeping program of social insurance, as they called it in those days, in Germany, which included comprehensive health care, old age benefits, disability insurance, whether you were hurt on or off the job. That was the Bismarck program. Now, why do you think a conservative German in the late 19th century, 1870s, 80s, would propose a sweeping program of social insurance, publicly funded? Well, because the Marxist Revolution was upon us. And Bismarck, though a conservative, was smart enough to realize that if he and his constituency, if you will, didn't respond to some of the concerns of German workers in this industrialized society, that you'd get something worse in the form of a violent revolution. And so the Bismarck Social Insurance Program was not only enacted into law in Germany, it became the model for many other countries, including Japan, which was just kind of emerging, you know, during the 1850s and 60s and 70s from where it had been historically, wanted to modernize, looked all over the world, and came to the conclusion that Bismarck's idea about social insurance made sense. So if you're wondering why Japan has a social insurance system not unlike Germany, it's because they decided to copy that. And Bismarck's ideas had a lot of resonance with the so-called progressive movement in the United States capital city. And we had Democratic progressives, we had Republican progressives. Wilson was a Democratic progressive, Roosevelt was a Republican progressive. And some of that had to do with trying to limit the power of monopoly and that kind of stuff, and all the trust-busting business, but a lot of it had to do with dealing with the consequences of the Industrial Revolution. And so, Roosevelt proposed universal health insurance effectively, 1912, and in 1916, folks, the Republican ticket for governor and lieutenant governor in Massachusetts proposed that the state move forward on a similar kind of program because the national government wasn't acting. Sound familiar? Now, if you know the answer to this, you don't take the final, you get an A+ of course. Who was the Republican ticket for governor and lieutenant governor in 1916 that proposed universal health insurance? The Republican ticket. Well, a guy named Samuel McCall, who, by the way, had a grandson named Tom McCall, who was the governor of Oregon, a wonderful guy, little Republican guy I served with, sadly died of cancer at an early age, terrific guy. And Samuel McCall's running mate in 1916 was Calvin Coolidge. And they proposed universal health insurance. Not successful. So we've been debating this thing for a long, long time. And when people, hi Kevin, how are you? One of my finest right here. Take his course. It's terrific. When people talk about improving the system incrementally, we've been doing this for a century. And speaking as a guy who's been on Social Security for 10 years, you know, I'm always reminded when people talk about doing things incrementally about what John Maynard Keynes, his famous British economist, once said. He said, in the long run, we're all dead. And, you know, when you begin to confront your own mortality, that becomes more and more relevant all the time. Anyway, so we've been debating this thing at least a century. And we've had 3 presidents that tried to do something about it. Especially 3 presidents. 2 Democrats and 1 Republican. Harry Truman, not Franklin Roosevelt, interestingly enough, who did a lot, but never took this one on. Just didn't think he could take on the American Medical Association, which at that time was strongly opposed to this kind of stuff. Interestingly enough, the AMA has endorsed the House plan. And that's an extraordinary event, let me tell you, in the history of healthcare reform in this country. And Truman essentially, in 1945, succeeding President Roosevelt when he died, said, look, we've now had Social Security up and running for, at that time, about 8 or 9 years. Seems to be working well. Let's just kind of add a modest increase in the payroll tax and provide health insurance for everybody through a government-run insurance program, but the delivery system would be unchanged. And he got pounded by the AMA, by whatever. It was communist medicine, it was Bolshevik medicine. People kept accusing him of proposing what the Brits were in the process of getting, which is the British National Health Service. Of course, the two are entirely different. And he kept proposing, won that incredible victory that nobody thought he was going to win in 1948, came back with it again, couldn't get anywhere. Because in those days, folks, even though the Congress, well, the 1946 Congress was Republican, most of the Congresses that he worked with were Democratic, they had a substantial number of white Southern Democrats, so-called, who were to the right of the Republicans, philosophically. And finally, in 1950, he said, well, okay, how about just doing it for people 65 and older? That's when the idea of Medicare. No dice. Same deal. Fought by the AMA, fought by all these other folks. Never got anywhere. 1960, young man from Massachusetts named John Kennedy, ran for the presidency and made Medicare, as we now know it, that is, government-provided health insurance for people 65 and older, an important part of his platform. And you know what happened to it under Kennedy? Couldn't even get a vote in the House. The chairman of the Rules Committee was a guy named Howard Smith, who was about 90. He was a Virginia Democrat, so-called. And he wouldn't even vote to approve. They had to, Tip O'Neill and a bunch of folks had to expand and reorganize the Rules Committee to get that guy out of there. Kennedy went to the Senate. They took a vote on Medicare. You know what happened to it? It lost. In a Democratic Senate. And it wasn't until 1965, after Jack Kennedy's tragic assassination, that Lyndon Johnson, supported by a really huge Democratic majority, still including some of these Southerners, proposed Medicare as Truman and subsequently Kennedy advocated. And even then, he almost lost it. Because I was chairman of the Ways and Means Committee, was a fellow named Wilbur Mills from Arkansas, an interesting guy, went to Harvard Law School, all that kind of stuff, from a small town in Arkansas. I'd call him a moderate philosophically. He was opposed to this. Getting the government involved in health insurance. And then finally, and of course Johnson was a master moving the Congress in investigations. It was Vietnam that really destroyed Johnson politically. He finally got Wilbur in a strange tour de force. Bill said, okay, I'll go for Medicare if you go for what we now call Medicaid, which is for poor folks. And so all of a sudden, in one fell swoop, we got Medicare and Medicaid at the same time, which was really stunning. But Johnson had to make two big compromises with the two opponents to Medicare, one of which continued to be the American Medical Association, and the other which was the insurance companies. Now these days, the insurance companies ought to think they're lucky stars that we have Medicare. Why do I say that? Well, they're the most expensive group of people to insure. Health insurance companies don't have to worry about people 65 and older except to make money selling supplemental insurance. Imagine if they had to insure older folks. Any idea what our premiums would look like? Look, my mother lived to be 100. Great woman. His dad was 94. He's still conducting the Boston Pops. But the older they got, the more health care they needed. And so Johnson made two big compromises. Of course, what worried the docs was that the government would start deciding what they could charge, right? So he said to the doctors, don't worry, we'll pay you your usual and customary fee, and you'll determine what that is. And he said to the insurers, don't worry, we'll make you our financial intermediaries. That is, you'll handle all the paper processing and that kind of stuff, and we'll pay you to do it. Which, by the way, is the way it continues to this day. So he bought them off, went along with his friend Mills's proposal for what we now call Medicaid, and we had Medicaid and Medicare at the same time. Well, in 1971, a fellow named Richard Milhouse Nixon, amazingly, was elected in 68, after having been defeated in 60 and defeated for governor of California 2 years later. And Nixon proposes his own version of universal health care. Anybody know what it was?
Virtually the same as what we're getting now?
Better. Better. Nixon said, look, I'm not for a government insurance plan, but we've got Social Security, it's working well, we've got Medicare, it's working well. All employers and employees ought to be required to contribute to health insurance in the workplace for themselves and their families. Without exception, all businesses, small, large, medium-sized, which of course isn't that unusual because today every business in this state and other state has to contribute to Social Security, has to contribute to Medicare, has to pay unemployment compensation taxes for unemployment insurance, and has to buy workers' compensation insurance for its workers. So Nixon said, let's just kind of complete the deal. All employers and employees will have to contribute, and we'll expand Medicaid to cover people who are temporarily unemployed. Unfortunately, and if he were here today, he'd tell you this, Senator Kennedy, Labor, the Liberals, opposed the Nixon plan. I heard him say once it was the worst political mistake he ever made. They wanted the Truman plan. They wanted the insurance companies out of there. Sound familiar? Public option, right? You know, when you get to be my age, you've heard these debates before. And it wasn't until 1973 that Senator Kennedy and his allies decided, hey, we better sit down with this guy and see if we can work something out. They were in the process of doing so, and they Watergate hit. That was the end of Nixon, that was the end of the Nixon administration, and that was the end of the plan. Too bad, because if, as he himself said, Senator Kennedy said, had they sat down and worked out something, today we'd have universal health insurance. And so it wasn't until 1993 that the fellow named William Jefferson Clinton came along and basically proposed a kind of complicated version of the Nixon plan. And despite the fact that he had a Democratic Congress, he couldn't get it through either. And fair to say that his failure to do so had a lot to do with Gingrich taking over the Congress and the Republicans taking over the Congress in 1994. So since World War II, 3 presidents, 2 Democrats, 1 Republican, each proposing a form of universal health insurance. No dice. So where are we? Well, we've got 46 million people without health insurance in the United States. By the way, overwhelmingly working or members of working families. These people aren't wealthy. They're not on welfare. If you're on welfare, you get Medicaid. They're working. Some of them 2 or 3 jobs, no health insurance. And of course, when they get so sick that they can't stand up, where do they go? You go to the emergency room at $1,000 a visit, and we're paying for it. It's crazy. I mean, the emergency rooms in this country have become the primary doctor for millions of Americans who don't have health insurance. And not only do we have 46 million uninsured people, and by the way, some 70 to 80 million who lose it at some point in the course of a 2-year period. Not just the 46 million, it's not a static number. It's people that lose it, get it, lose it, get it. But we're paying the highest health costs per capita on the planet Earth. And by the way, in Massachusetts, the highest in the United States. So we have the interesting distinction of paying more for health care in Massachusetts than anybody anywhere in the universe. At least as we know it. And in fact, we're paying double per capita. Now, this is 10% more, 20% more, folks. This is 100% more. Than who? Than Canada, Germany, England, France, Italy, Japan, Australia. Now, they all have different systems. Some of them are single payer, some of them are multiple payer, some of them are this, some of them are government run. But to a remarkable degree, they're all roughly spending half of what we're spending on much more comprehensive health care. Includes long-term care. Hell, in Germany, you can go to the spa once a year if the doctor recommends it. I'm serious, on your health insurance. And Germany's got a terrific health care system. No waiting lines. You know, it's fine. Half the cost. So somewhere in this American system, not only are we providing coverage for all of our fellow citizens, but we are spending a huge amount of money that these folks, for some reason, don't seem to have to spend. And by the way, they have better health outcomes than we do. Higher life expectancy, lower mortality. Well, okay, here we are. 2009, new president. Strongly committed to this. We've all been calling this debate, I hope. I know it's a little confusing, but it's really not that confusing. Essentially what we're talking about is a variation on the Nixon plan, but not as comprehensive, and with a much heavier burden on the public treasury. Why? Well, because under the Nixon plan, if we, for example, were to pass the Nixon plan tomorrow, 2/3 of the uninsured would be covered. And you wouldn't have to get into this question of aliens and legal aliens and all that kind of stuff. Legal aliens and all that kind of stuff. If you work, you get health care yourself, leaving us not with 45 million uninsured people, but about 15 million. That's a much easier number to deal with than 45 million. And then maybe you can use some public subsidies and create a public option or do whatever you want. And as you know, that's what we try to do here in Massachusetts. The problem is that we do not have an employer-employee mandate in the state to speak of. So So the state has become the insurer of last resort. And let me tell you folks, that's very expensive. I mean, it isn't we don't want to do right by people when it comes to health care, but we've got a public higher education system that needs help, and a K-12 system that needs help. And we've got a state which frankly looks like one giant pothole when it comes to our infrastructure. You know, just, this is not a campaign speech, but my successes were disasters when it came to the fiscal infrastructure of the state. So we've got other needs that we have to deal with, and if trying to be the insurer of last resort starts draining the public treasury dry, I've got stuff left for this institution and lots of others. By the way, I'm a huge fan of the state colleges and community colleges. I think they just, it's not that I don't love the university, but you know, this is where more and more young people in this country are going to get their education. And it ought to be and should be a top-notch education, and that takes resources. So the concern, I think, that all of us have about what seems to be emerging as a plan in Washington is not that it will not significantly increase the number of folks that do have basic health security, though there will still be several million people without coverage for a variety of reasons. But it's going to put enormous pressure on the public treasury. Now, in point of fact, and this is one of the things that makes it so confusing, I do not understand why our friends in Washington, all of them, insist on talking about budget numbers in 10-year increments. You know, it's going to cost $1 trillion. Sounds like a bailout, right? Well, $1 trillion over 10 years is $100 million a year. And in point of fact, the plan that emerged from the Senate was costed out at about $820 billion over 10 years. That's $82 billion a year, folks. That's 1/3 less to the tax cut for the rich that Bush signed as President of the United States. It's 8 months in Iraq. I mean, let's put this thing in proportion. And let me tell you something. If we can't find $80 billion a year in waste in a healthcare system that's spending $2.5 trillion a year or something about it, it should really cost us one additional dime. So it's eminently affordable, notwithstanding what's happened in terms of the economic crisis, the bailout and that kind of stuff. And when you compare this $82 billion against what we get, what do we give AIG? Twice that? Twice that for one insurer. I think it puts it in real perspective. Now, my guess is that we're probably going to get a plan. It's complicated by the fact that in the Senate we have this foolish filibuster rule, which now virtually requires you to get 60 votes to pass anything. Now, with the possible exception of the state of California, so far as I know, where you need a 2/3 vote to pass a budget, which is one of the reasons why they're all screwed up. I don't know of any other parliamentary body in the world where a majority of the members can't, after reasonable debate, decide they want to go to a vote. When I was in the Massachusetts legislature, we had 3 or 4 windbags. We would go on and on and on. After 3 or 4 hours of debate, any member of the legislature could stand up, say, Mr. Speaker, I move the question. It's not debatable, it's not amendable, it has to go to a vote right away. The majority of the chamber says we're ready to vote. We've heard enough, you can do that. You can do that in the House in Washington. You can't do it in the Senate. Because that filibuster rule, and by the way, it used to be 2/3. And it was used repeatedly by Southern, white, racist Democrats, if I may say, to stop civil rights legislation. So the big compromise, the big victory under Johnson was that it was cut down to 60. But 60 votes is hard to get, folks, in a body of 100. Trust me. It's hard to get. I mean, if it weren't for the 60 vote thing of the filibuster rule, I have no doubt that we'd have a good comprehensive plan on its way to the president. So we will see what happens in the Senate. But I think we're going to get a bill, then it's going to go to, the House is going to pass its bill, we're going to have a conference. There's probably still going to have 4 or 5% of the people in this country uninsured. That's a hell of a lot better than what we got. And then I think over time, we'll get closer and closer to 100%. Now, what about cost control? Well, there isn't an awful lot in any of these plans that really controls costs. And this is just Dukakis talking. You can accept this or leave it. But anybody who thinks the market works in healthcare is kidding themselves. It doesn't. And I'm not sure, even if it did, we'd want it. In a healthcare system, I mean, this is not like going down to Best Buy and buying a television set. You know, this is healthcare. You want stability, you want quality. You don't need creative destruction, right? Which is what presumably the marketplace provides. Not in healthcare. And in any event, we license everybody and anybody that does anything in healthcare right now at the state level, right? You can't be a doctor unless you're licensed. You can't be a nurse unless you're licensed. You can't be an X-ray technician unless you're licensed. You can't run a hospital unless you're licensed. You can't run a nursing home. Why? Because we want quality and safety. And it's one of the reasons why healthcare today is a million times better than it used to be because of this licensing stuff. But if you're going to license, regulate, then talking about a marketplace is ridiculous. And in any event, when you got a very sophisticated consuming public, all of whom want to go to the Mass General to bring it, they really get sick. Talking about competition is ludicrous. And the thing, and I'll conclude with this, so we can get to a discussion, the thing that distinguishes all of these other national health cases with whom we compare ourselves, all of whom provide comprehensive health coverage for everybody at a half of the cost per capita that we do, is that they regulate costs. No fooling around. And you may like this, you may not like this. I mean, I like the market. Hell, I go to Target a year ago and bought a waffle line for 13 bucks. My grandkids love my pecan waffles. Well, they like the pecan, but they like the waffle. You know, where did it come from? I think it came from China. How can you make it a waffle line and ship it over here for 13 bucks? But that's the marketplace at its best in some ways, right? But I don't want that kind of a marketplace, frankly, when it comes to my health care. I don't think most people do. But if you're not going to have a marketplace, then you've got to control costs. And the thing that is missing, frankly, in any of these plans in Washington, and is still missing here in Massachusetts, is a system that regulates costs. The governor just the other day, in fact it was yesterday, took the first step in that direction by saying that he's very upset with premium increases for small businesses, and he should be. In a zero inflation economy, 18 to 20% increases healthcare. How do you explain that for small business? I mean, inflation is zero. What happened in the last 12 months to justify a 20% increase in health insurance premiums for small business? So the governor has said he's going to begin using the authority he currently has to review and approve or disapprove increases in health insurance premiums. And he has that authority. At least when it comes to small business, and ultimately I would hope he'll use it for the healthcare system in general. So we started squeezing a lot of this duplication, inefficiency out of the system. Interesting enough, folks, Medicare is a hell of a lot more efficient than private insurance companies. You know that? Medicare takes about 2% for overhead. Don't ask me what the number is in the private sector. 10, 15, who knows? That doesn't mean that government necessarily is always more efficient. When it comes to managing the system and taking the least possible amount out of it for administrative costs, Medicare, and presumably this proposed public option, would be a lot more efficient, and it's one of the reasons why the insurance companies are worried about it. Because if it is more efficient, at least administratively, then it means that folks are going to start gravitating to the public option and walking away from insurance companies. Well, that's something we've got to work out. In any event, that's about where we are. As I say, I think we're going to get a plan. It's not going to be even as good as the Nixon plan, which really would have covered everybody at substantially less public cost. But it's certainly a major step forward, and it's going to be interesting to see whether, in fact, by the end of the year or thereabouts, the President of the United States is signing something at least approaching a comprehensive and universal plan.